All right. Thank you, everyone, for coming. Definitely deja vu seeing everyone. And notice how the wall colors haven't even changed. We just had such good timeless taste. But we also have a very special guest here today, which is Peter, who was our complete responder on the AC trial and flew in all the way from Seattle. So thanks for coming.
Yeah.
And we figured for extra reminiscing and also to give people a sense for some of the impact that your work had, it would be good to do a little Q&A with Peter. So we'll try to keep it short, but the idea is to get a sense for Peter's experience, and you'll all see some of the connections to work many of you were involved with. Thanks a lot for coming. I think for the rest to get to know you, if you want to give a little background on yourself, what were you doing before you decided to be a cancer patient? All that
Yes.
exciting.
Yeah, lifelong aspiration to be a cancer patient. I'm a high school teacher, actually. So I've been teaching high school for about 23 years now. First taught English as a second language overseas, came back to the States, ended up teaching at a high school nearby where I live. So I grew up in Alaska. My dad was a surgeon, actually.
What were you doing for fun?
Kickboxing, actually, and mountain climbing were my big sports. I had only laid kickboxing aside about a year before the cancer happened.
Oh, okay.
Yeah.
And when did you first learn about your diagnosis?
I went in for a colonoscopy January 3rd,
Yeah.
2020. I remember it actually specifically because I had just had to switch my insurance over. And I remember I'd always been a super healthy dude up to that point in time. And so I'd always done the cheapest insurance possible. But this time I was trying to balance my kids on it. And long story short, I went to hell with it. And I got the most expensive possible insurance you could get. And 3 days after it kicked in, I was diagnosed with rectal squamous cell carcinoma.
And what kind of treatments did you end up having to go through at that point?
We did chemo and radiation for the initial tumor.
Yeah.
And that managed to kill everything. I was on about 7 weeks of radiation. So yeah, I was pretty hollowed out by the end of that.
Yeah.
And we managed to kill that tumor. But then by that July, it had metastasized to my liver. And we knocked that back with SBRT. And then it metastasized to my lung. And a year later, we knocked that with SBRT. Then it metastasized to my lymph nodes. And we tried chemo, and that didn't work. And then I found you guys after that.
How did you find us?
Taking 6 months off for chemo, I had a lot of time to read. I was naive enough about immunology that when I heard my doctor say immunology, I went, oh, you mean like mushrooms? It made a lot of study for me. So I started reading up a lot. And one of the first things I realized is that I had HPV positive cancer. And I couldn't think of a better tumor specific antigen because, yeah, if you kill every single cell in my body that has HPV, all good. So, yeah, I dove in. So then I got on clinicaltrial.gov and just started contacting various different trials. The first one I really wanted was your APC trial, but that was out of Scottsdale. And I'm in Seattle, and that's too far. And the AC one was in Portland. So I ended up there.
Oh, okay. So you reached out to the site at that
did.
point?
I did.
And when you first learned about cell therapies as a concept, what did you think about that?
Space age. It's like the Jetsons or something. I really wrapped my head around the idea of the antigen presenting cell stuff. And so that's where I would, so that part sounded cool to me. I wasn't sure about the red blood cell stuff. Yeah.
And what was the experience like going through the treatment process? Because I think even though a lot of us worked on it, many of us never got to actually see what happens.
Yeah, it's a very fast infusion, right? It's, I think, just basically a syringe that just gets pushed in slowly. And it could have been a placebo for as far as I knew. The only thing I can remember about the treatment itself is, you know how when you have a port, anything you get injected, it gives you a little bit of a taste. And I have to say that the squeeze thing tasted a little like tomato soup. But that was I had no side effects whatsoever. The only effect was, like after 2 treatments, the tumor had reduced by 72%.
Yeah, and how was it hearing about that? I know you had mentioned your surgeon's reaction.
Yeah, I think he mismeasured it as we turned out in the long run, but it was still a startling drop. I was telling Armin that after 2 treatments, we did a biopsy, and you're coming out of the anesthesia, and there's this surgeon standing there, and his eyes were just this big around, this huge grin on his face. And he just couldn't wait to tell me that it had reduced by 72% just from first treatment to that.
And how did the profile of the treatment from like how you felt afterwards and during compared to, I don't know, going through radiation, chemo, all these other zones?
Oh, it's so much easier than anything else I'd done. Still to this day, I've done, well, the only thing that would compare would be Pembro.
Yeah.
I haven't really had any reaction to Pembro, but honestly, you could have been feeding me placebo the whole time except for the cancer disappeared. Yeah.
And I think you had mentioned something like you had suggested like posting a video of you like going kayaking the next day or something.
When I heard that Squeeze might be in trouble, I wanted to save Squeeze because I was figuring it was saving my life. And so what I wanted to do is, I'm a big kayaker. I wanted to get my treatment, and then OHSU is right on the river in Portland. And so I wanted to go from treatment down to my kayak and then kayak up into Washington. And then just like, you too can be out kayaking after the season. So I think I even contacted Armin and said, hey, I'd do a kayaking thing or something.
Yeah. That would have been cool. And then how was life after that? What things changed beyond that?
When I went through chemo, I was obsessed with the idea of how much time I had left. I was doing all those, trying to figure out, look at the overall survival rates of this, that, and the other. And because my cancer is a little unusual, it was trying to do a lot of math to guess how much time I had left. And at a certain point with the AC trial, I just stopped thinking about it. I just started figuring, okay, I'm living here and just time to get back to living.
Yeah. At what point had you found out that you were a complete responder?
After I got to 72%, I felt pretty good. Okay. And then that was, I think, might have been, I don't know, I don't remember, January, February?
Yeah, January, I think.
And I think around in March or so, we couldn't find the cancer after that. And so I really, again, a sign of naivete, but I really felt I was completely cured. And so I was just moving forward.
Has it changed any of your outlook on science, medicine, trials? What nerds like us do all day.
I tell everybody the best thing that happened to me about cancer was it got me all excited about biology. I had to relearn everything. And I had to dug out my son's AP biology text and worked my way through it. And then through cancer text, it's so cool what's happening right now. We're on the cusp of so many different breakthroughs. And this thing, the thing that Armin is putting together with this cell therapy where you can use almost any kind of cell and load it with almost any kind of cargo, it's just mind-blowing. The whole thing is mind-blowing to me.
Yeah.
God, this is, thank you. I don't know what else to say.
We're doing it for people like you. And I think I'm speaking for a lot of the people in the room where our side of finding out about these things is many have spent multiple years on it and countless hours trying to get it ready, doing practice runs in manufacturing, all kinds of things. But you get this like sliver of news, oh, it may have worked. And then you see like a nonchalant mention in a press release. We're like, oh my God, what we did actually mattered.
Yeah, huge.
Yeah, we didn't spin our wheels for no reason, at least. Any final thoughts you wanted to share with the team? I'd probably say 50% of the people in this room had something to do with it.
The treatment, the way I look at the Squeeze treatment is it gave me 18 solid months because the cancer went down to where it was nothing. And then it eventually got to where it was before I entered treatment. So then I did another trial with NIH, which was much, much more brutal. I had full cytokine release on that one. And that was, I peeled from the neck down. But that one didn't work. But still the disease has been fairly indolent. It's just been in the one spot. And so in February, I talked to my doctor and we radiated that. But I'm still doing Pembro every 3 weeks. And I will have a scan on the 11th. To see what's left. And we're thinking we might have got everything. Then you just keep doing what you're doing and you guys keep doing what you're doing.
Thanks a lot for flying out here.
Thank you for flying out.
Yeah. I think it was very special when you had started reaching out to folks and we're like, oh my God, we get to, because we don't usually know anything about you. We're firewalled from all of that. So unless people like yourself reach out, the people at the companies have no idea who the patients are. So once you reached out, we're like, oh God.
LinkedIn. Yeah. Without LinkedIn, I wouldn't have found you guys. Yeah.
You know everything about us. We know nothing about you. Well, thanks a lot. It's all for people like yourself, and hopefully we'll get more things going. I mean, many of the team are obviously at a lot of other companies now fighting the good fight. So hopefully the seedlings for many new things to come.
Yeah, you guys are the future. It's very cool. Thank you.
All right.
Yeah.
Thank you.
Thank you, Lynn.